Good evening and welcome, everyone. Thank you for joining William Osler Health System's Community Telephone Town Hall. My name is Gurjeet Corbains, and I'm a member of Osler's Patient and Family Advisory Council. I was born at Osler's Etobicoke General Hospital, and I've had the privilege of living in Brampton for the last 33 years. I identify as a Sikh Canadian woman. Throughout my career, I've been fortunate enough to work alongside wonderful educators and students as a high school teacher in North Brampton. And now I have my own family mediation practice within the Brampton community. In addition to my work, I have been an active volunteer within our community, and I've also been blessed to enjoy some beautiful travel over the years, which I've shared with my husband Harjot and our 3 young sons. I'm pleased to be back moderating another important telephone town hall with Osler. Please note that tonight's call is being recorded and will be available on Osler's website. Before we begin, I would like to acknowledge that our health system is situated on the traditional lands of the Huron-Wendat, Haudenosaunee, Anishinaabe, and the Mississaugas of the Credit First Nation. We respectfully recognize a multitude of distinct First Nations, Inuit, Métis, and urban Indigenous peoples who are the original caretakers of the lands and waters now known as Canada. Indigenous peoples' knowledge, wisdom, and traditional practices are invaluable enrichments to society, past, present, and future. Indigenous peoples experience ongoing injustices due to colonialism, including the impacts of intentionally harmful and unjust healthcare and research practices. These violations continue to affect the health and well-being of Indigenous peoples, resulting in intergenerational trauma for individuals, families, and communities. Aligned with our commitment to equity, diversity, inclusion, and health justice, we have shared responsibility to lead with our organization's values of respect, service, compassion, and collaboration. With gratitude, we commit to ongoing learning and action by cultivating authentic relationships with Indigenous peoples, caring for the land to support healthy communities, educating ourselves on Indigenous cultures, providing care with cultural humility informed by Indigenous practices and beliefs, and respecting Indigenous ways of healing. Over the next hour, Osler leaders will share hospital updates, including the progress on transforming Peel Memorial into Brampton's second hospital, Osler's partnership with Toronto Metropolitan University's new School of Medicine, and how to access care over the coming cold and flu season, and more. We look forward to having meaningful conversation with you, either on the phone or through questions submitted on Osler's website. We will also be asking a few polling questions, to which you can respond using your phone or on Osler's website. I will provide instructions when we are ready for the questions. To be placed in the queue to ask a question, please press *3 on your phone at any time, or submit a question at williamoslerhs.ca/townhall. We will get to as many of your questions as possible. For those callers who we cannot respond to during this 1-hour live event, I will provide instructions at the end of the call on how to leave your questions so Osler can get back to you. To those just joining us, welcome to William Osler Health System's Community Telephone Town Hall. I would now like to invite Connie Stavenkovich, Osler Board Director, to say a few words.
Thank you, Gurjeet. Good evening, everyone. This is my first Osler Community Telephone Town Hall, and I'm very honored to be here. I have more than 30 years of experience in the financial services industry, where my work has always been guided by collaboration and integrity, and I'm proud to call Etobicoke my home. Serving on Osler's Board of Directors and supporting our local health system is something that I see as a continuation of my career, and it is both an honor and a responsibility that I value deeply. I've been a member of Osler's Board of Directors since 2023. I am currently on the board's Health Services and Quality Committee, and formerly on its Governance Committee. I respect Osler's commitment to open and transparent conversations with our community, and we truly appreciate you taking the time to join us this evening. Before we hear updates from our leadership team, I'd like to take a moment to express the deep pride I feel for Osler. Osler's leaders, frontline teams, learners, and dedicated volunteers continually demonstrate exceptional commitment and compassion, always going above and beyond for our patients and families. On behalf of the entire Osler board, I extend my sincere gratitude to all of them and to you, our community, for your continued trust and support of our hospital system. I'll now pass it back to Gurjeet.
Thank you, Connie, for your leadership and your kind words. For those who have just joined, if you would like to ask a question or make a comment, press *3 on your phone. This will bring you into the question queue to speak with one of Osler's leaders. We kindly ask that you keep your question brief so that we can get to as many as possible. I would now like to ask Dr. Frank Martino, Osler's President and CEO, to give his update.
Thank you, Gurjeet, and good evening, everyone. Gurjeet, thank you for once again hosting the telephone town hall. These conversations are at the heart of what makes Osler a community hospital. I am grateful for everyone who's joined us online tonight. This event complements our ongoing efforts to speak with and hear from our community all year round at various events, including, for instance, the Brampton Farmers Market this past summer. And thank you, Connie, for being here tonight, for your leadership, and for your words of appreciation. I'd like to start my remarks tonight with some very exciting news. I'm immensely proud to announce that Osler has once again been accredited with exemplary standing from Accreditation Canada for the second consecutive survey. So what exactly is accreditation, you might ask? Hospital accreditation is an important review that ensures a hospital meets the highest standards of quality and safety in patient care. To be accredited with exemplary standing is actually the highest possible designation in the country for hospitals and reaffirms Osler's commitment to safety, quality, and to providing innovative health care delivered with compassion. It is not an easy task. It took every person in our health system to achieve this, and it really is a reflection of their dedication every day. Osler's staff, physicians, volunteers, and learners embodied commitment to excellence in care. I am grateful that Accreditation Canada's surveyors witnessed this firsthand, and I'm incredibly proud of how we consistently work together to achieve our vision of world-class healthcare inspired by our people and communities. Important progress has also continued on the transformation of Peel Memorial into Brampton's second hospital. Scott Patterson, Osler's Vice President of Facilities, Operations, and Capital Development, will speak more about this in a few minutes. Now, over the summer, we celebrated another exciting milestone. As the primary clinical partner for the Toronto Metropolitan University's new School of Medicine, we were thrilled to welcome the first TMU group of medical residents in July. Many Osler physicians have taken on teaching roles, deepening our evolution from a community hospital into a dynamic community teaching hospital, proudly training the doctors of the future right here in our community. Dr. Hemant Shah, Vice President Academics, will speak more about this tonight. As we look ahead forward this fall, and in fact actually next week, our Osler Research Institute for Health Innovation team is planning Celebrate Research Week 2025, an event that brings together innovation, community, and creativity to highlight the impact of health research. Tiziana Rivero, Osler's Executive Vice President for Quality Research and Chief Nursing Executive, will share more about this very shortly. Before I turn it back over to Gurjeet, I want to take a moment to share once again a heartfelt thank you to Osler's healthcare teams for continuing to provide outstanding care to our community, to our patients and families for their continued trust in us, to our many community and government partners for their ongoing support, and to our donors for their continued generosity. Over to you, Gurjeet.
Thank you, Dr. Martino. I would now like to invite Dr. Hemant Shah, Osler's Vice President of Academics, to speak.
Good evening, everyone, and thank you, Gurjeet. I'm very happy to be part of this great event again. As Dr. Martino mentioned, earlier this year, Osler welcomed the first classes of students from the new Toronto Metropolitan University School of Medicine in Brampton. Specifically in July, Osler welcomed 105 new student doctors, residents, as part of the school's first ever cohort. And in September, Osler supported TMU as they welcomed 94 medical students beginning their studies. These learners are now training across our hospitals in Brampton and Etobicoke, as well as in local family doctors' offices. They're seeing the full picture of health, how housing, income, and culture shape the well-being of our communities. And they're learning to care for the whole person, not just the illness. When you come to our hospitals and clinics, you may see these medical learners accompanying our doctors. They will always be introduced to you, and we truly appreciate your support in helping to train the next generation of physicians. Each interaction, each conversation, each story helps shape them into compassionate, community-minded doctors of tomorrow. To support our growing community of learners, many Osler physicians have taken on new roles as faculty and educators. They've embraced the opportunity not only to continue to deliver exceptional care, but also to guide, mentor, and inspire the next generation of medical leaders. In this way, we are ensuring that we're caring for you and all of our collective future at the same time. By joining education and research with our strong clinical foundation, we are building a health system that delivers faster, better solutions for every patient who comes through our doors. Together, we're shaping Osler, in Brampton, in Etobicoke, and beyond, into a place where healthcare talent thrives, innovation flourishes, and our communities receive exceptional care close to home. Thank you, and I look forward to your questions during the live call. Back to you, Gurjeet.
Thank you, Dr. Shah. As a reminder, if you would like to ask a question or make a comment, press *3 on your phone. We kindly ask that you keep your question or comment brief so that we can get to as many questions or comments as possible. We would now like to open the line to answer your questions. Please press *3 on your phone to bring you into the question queue and speak with Osler's leaders. Again, we ask that you keep your question brief so that we can get to as many as possible. Our next question is from Bulbir. Hello, Bulbir?
Yes, ma'am.
Go ahead with your question, sir.
Yeah, I have a question that I'm happy with the service given by the Osler, but there is a growing demand of the population that we need another hospital. So if we can get that near sooner, because there is a long wait time. People has to wait sometime 2 to 3 to 4 hours to get to see a doctor in emergency. You know, the emergency means emergency. So somebody goes there for emergency, it means he need a help with the forthwith help, not like waiting for 4 hours. So that's what, all right.
Thank you for your question, Bulbir. I'll pass it over to Dr. Frank Martino to answer for you.
Bulbir, thank you for your question. You know, I began working in emergency medicine at the old Peel Memorial 35 years ago. And what I can tell you is that our emergency departments are probably one of the busiest in the country. In the city of Brampton, we operate 2 facilities. We operate our emergency department at Brampton Civic and our 24/7 urgent care center at Peel Memorial. Etobicoke General has a busy emergency department as well. But out of the 57 peer national hospitals, we have the shortest wait time, believe it or not, for physician initial assessment. That means after you've been triaged, assessed by the nurse, the time it takes to see a physician. We're very proud of that. We also have a wait time clock that is both online and in the waiting room in our emergency departments. Our physicians are here to take care of you. And sometimes when you come to an emergency department, you have a complex medical condition that requires multiple investigations, blood work, diagnostic imaging, x-ray, CT scan, ultrasound, and that takes time. You may also require treatment, and treatment doesn't happen with a flash. It may take 2 or 3 hours. And then the physician needs to decide whether you need to come in the hospital or be discharged home. And a plan to safely go home needs to be put in place. So, patients tell me all the time, I was there for 8 hours, but during those 8 hours, was your problem addressed? And often they say, almost always, yes, it was. And I think we should be very proud of the emergency physicians, the emergency department nurses and staff that provide the care in our community. Where are we going? Well, we are building the Peel Memorial Hospital, and you'll hear more about that. And it will have a 24/7 emergency department in the years to come. And my hope is those 3 emergency departments will truly meet the needs of our community.
Thank you, Dr. Martino. Our next question is also live. We have Sayuber on the line with us. Go ahead with your question, please.
I already left my question.
Hi, I'm sorry, I didn't catch that.
Yeah, so I already asked my question to the team.
So I think your question was that many people visit hospitals often and you need some more info about when to go there or when to call 911. I'll ask maybe Kiki to answer that question for us.
Thank you very much for your important question. If you're ever in doubt, you should always call 911. That is the first thing to do. So don't hesitate. There are services, if it's not an emergency, for you to get help with. Obviously, calling your primary care doctor is one way. You can also call 811. That number provides some important services and tells you what services there are available in the community. But always err on the side of caution. If you're thinking about calling 911, that's probably a sign that you should.
Thank you, Kiki. Our next question is online, and it's from Nisaiba. The question is, could you share some examples of current projects underway at Osler and what future initiatives or priorities you are most excited about? I'll turn that over to Dr. Martino.
That's a great question. What I can tell you is that anything that provides high-quality care for our community excites me. And I can tell you at Osler, we have a plate full of really exciting initiatives. We're in the process right now of implementing an advanced hospital information system, one that is a technology along with associated artificial intelligence will really bring innovation to the bedside. And we're very excited about that. And that's what we call here at Osler Project Unify, and it's adopting the EPIC hospital information system. We're also very excited about the redevelopment of Peel Memorial into Brampton's second hospital, and you'll hear more about that this evening. I can say that the TMU initiative, the Toronto Metropolitan University School of Medicine, and our multiple academic partnerships with Humber College, Sheridan College, University of Toronto, that will be, will have learners and develop the health human workforce of tomorrow excites me significantly. And very shortly, in the next few months, we'll be opening our third cath lab, our third catheterization lab in our cardiology department. We see probably more cardiac disease than any other region in the province, and so we're proud of expanding our services for our community. That's just a handful of things that excite me, besides maybe the Blue Jays winning next year.
Thank you, Dr. Martino. Our next question is live. We have Randall on the line. Hi, Randall.
Hello.
Go ahead with your question.
Well, I have a question with no disrespect to the students, and I applaud their taking up a medical career. What options, or will these student doctors and nurses and attendees identify themselves as such to the patients as they come into the hospitals? And do I have the right at that point to graciously say, no, thank you, I would like to see an actual doctor? How will that be responded to?
Thank you for your question, Randall. I'll turn it over to Dr. Shaw.
Hi, Randall. Thank you for the question. So let me start out by saying that all of our students and learners across the health profession are required, as per our policies, to identify themselves as students or residents or nursing students, whatever the case may be. So absolutely, that is our expectation. We provide them that information in their orientation. And remember, these are generally already highly trained individuals, and they take their professional obligations very seriously. In the health professions, we train individuals according to the principle of graduated supervision. What that means is that every learner is always supervised at all times. But as they become more senior, the nature of that supervision might change. So, for example, a fifth-year resident, so who's been a doctor already for 5 years in surgery, is very different from a third-year medical student who has not had, that additional 7 years of experience. So I don't want to lump all learners into the same pool. They're all very different from each other. They're unique, and we take that into account when we supervise them. But your question around whether, you are required to interact with learners, the answer is no. You certainly can have the choice not to interact or, respectfully ask a learner that you'd rather, see the staff physician or staff nurse. That is absolutely within your right to ask for. I hope that maybe a little bit of what I've said might convince you that that's not necessary, and you would instead see the learners as part of the care team, because all of the care we provide here is team-driven, and all members of that team have value in the roles that and what they bring to the care.
Thank you, Dr. Shaw. Thank you, everyone. To ask a question or to make a comment during this live event, press *3 on your phone. This will bring you into the question queue to speak with one of Osler's leaders. We kindly ask that you keep your question brief so that we can get to as many as possible. Before we take any more phone or web questions, I'd like to invite Scott Patterson, Osler's Vice President, Facilities, Operations, and Capital Development, to share the latest on Osler's redevelopment project.
Thank you, Gurjeet. Good evening, everyone. I'm very pleased to be here tonight to share big news for our community as the new Peel Memorial Hospital project moves forward. As Dr. Martino mentioned, Osler recently reached another important milestone. We advanced to the development phase of the project. We did this by entering into a development phase agreement with a company named Bird Design Build Construction, Inc. The company was selected through a competitive request for proposal process that began in October of 2024. Bird Design Build Construction will work with Osler and Infrastructure Ontario to advance the project requirements, including completing the design, establishing a schedule, and a budget. This is a great achievement in the transformation of Peel Memorial into Brampton's second hospital. Once the development phase is complete, Osler and Bird Design Build Construction will have the option to sign a final agreement to move forward with the building of the new patient tower. We know these huge projects only happen when everyone comes together, and we look forward to continuing to partner with the Ontario government, Infrastructure Ontario, the City of Brampton, Osler Foundation, and our community. And now, with Bird Design Build Construction, Inc., to build the new state-of-the-art hospital this community needs and deserves. We are very excited to continue this transformation and to help the community have timely access to high-quality care close to home when and where they need it the most. Together, we are building a healthier future for generations to come. Please continue to follow along with this transformational project by checking Osler's website and following us on our social media channel. I'll now hand it back to Gurjeet.
Thank you, Scott. That's wonderful news for our community. Thank you for sharing. I'll now ask Ken Mayhew, Osler Foundation's President and CEO, to say a few words.
Thank you, Gurjeet, and good evening, everyone. As you've heard, throughout 2025, we've been celebrating a remarkable milestone in that we have 100 years of exceptional care at Peel Memorial Hospital. And I can't help but think that in 1925, when we started as a small community hospital, we likely had no idea the impact we were going to have on our community. For generations, families have walked through our doors to welcome new life, to recover from illness, sometimes to find comfort in times of loss. And though times change, one thing has never changed. The community's pride in Peel Memorial has been a constant in Brampton's history for over a century. The centenary serves as a reminder that this hospital's story just isn't about the last 100 years. It's about building the next. It's about our role in building the next. It's about you, the donors and partners who continue to make progress possible. As you know, the next chapter will transform Peel Memorial into Brampton's much-needed second hospital, one of the most important healthcare investments in our city's history. And these are certainly very exciting times, as you've heard from Dr. Martino and others across our healthcare system. And the Osler Foundation is so proud to work with the community members like all of you to raise the funds needed to make those important initiatives realities. That is because 100% of the equipment in our hospitals and 10% of construction costs must be funded by the community. So with a new hospital to build and equip and ongoing equipment to replace across Osler, the amount of funds that we as the foundation, the community will have to raise over the next number of years is immense. The good news, we are not alone. We are very fortunate to have incredible champions in Mayor Patrick Brown and Brampton City Council who understand the important priority of healthcare needs. And I'd like to take the opportunity very specifically to thank Mayor Brown and Brampton Councillor for their incredible support and for hosting fantastic events like Hockey Night in Brampton. We're already looking forward to next year. And though we receive generous donations throughout the year, this is an especially important time. This is the giving season for people who choose to donate at this time of year, do so often for cultural and for religious reasons. One incredibly exciting example I was very proud to be a part of, Radio Homespar, in partnership with the City of Brampton, recently hosted a radiothon in celebration of Gurpurab, an auspicious occasion in the Sikh calendar. Once again, the community stepped up to raise critical funds, and we're so grateful for that. Unfortunately, and as you would all know, for the second year in a row, a nationwide postal strike has significantly impacted the ability of our donors to send direct mail contributions to the campaign, funds that are critically needed. So while mail operations have now resumed, we want to remind you that there are actually a few different ways that you can give. At any time, you can walk into any of our hospitals, speak to the people who welcome you as volunteers, and ask to make a donation. We had offices at each of the Osler sites. You can also give online at oslerfoundation.ca. That's oslerfoundation.ca. We'd be incredibly grateful for your support. As I mentioned off the top, we're in the season of giving for many cultures. And if you're planning your year-end donations, I sincerely hope that you'll welcome Osler as part of those considerations. Every dollar is needed, every dollar makes a difference, and every dollar will be something that we're very grateful for. But now I'd like to turn things back to Gurjeet. Thank you.
Thank you, Ken. Osler Foundation does so much to support healthcare for our community. We very much appreciate everything you and your team do for our hospital and, in turn, for our community. We will now ask our first polling question. To answer the question, please press the number on your phone that corresponds with your answer. Press 1 if your answer is yes, I am very aware of Osler's plans to transform Peel Memorial. Press 2 if your answer is I am aware but don't know the details. Press 3 if your answer is no, I was not aware of Osler's plans to transform Peel Memorial before this evening. Let me repeat the question and your response choices. Before this evening, were you aware of Osler's plan to transform the Peel Memorial site into Brampton's new hospital? Press 1 if your answer is yes, I'm very aware of Osler's plans to transform Peel Memorial. Press 2 if your answer is I am aware but don't know the details. Press 3 if your answer is no, I was not aware of Osler's plans to transform Peel Memorial before this evening. Please enter your response on your phone now. I will share the results shortly. We now would like to open the line to answer more of your questions. Please press *3 on your phone to bring you into the question queue and to speak with Osler's leaders. Again, we ask kindly that you keep your question brief so that we can get to as many as possible. Our next question is live from Millicent. Hello, Millicent. Good evening.
Hello.
Hi, go ahead with your question.
My question is, why is it, what's the reason behind that a patient has to wait for MRI for 3 months when the situation can be very critical?
Thank you for your question, Millicent. I'm going to pass this question on to Tony Razzo. Tony?
Hi, good evening, and thank you for your question. So as you know, MRI and MRI testing has advanced significantly over the years, and the demand for MRI has also advanced. And so when you look at the number of MRIs that we have available, we expect that there will be some degree of a wait time. But I want to reassure you that if it is critical and you need access to an MRI, then we actually prioritize that MRI to support your medical needs. Hope that answers your question.
Thank you, Tony. Our next question is an online question from Soma that came through our website. Her question is, I am a registered nurse working in home care. How can I get a job at Osler? I'll pass that question on to Tiziana.
Thank you, Soma, for your question, and thank you for your interest at Osler. If you are looking for a really rewarding career and want to join our team, we encourage you to please visit our website for more details to see how you can serve your community through a career at Osler. Thank you.
Thanks, Tiziana. Our next question is a live question from Susan. Hi, Susan. Good evening. Go ahead with your question. Susan?
Yes. Hello.
Hi, Susan. Go ahead with your question.
Thank you. I just want to say I want to commend oncology. Just last week, they added an additional waiting room, which is excellent. Because as you walk in, people are standing in the hallways. They're standing. The main waiting room is so full. So they now the extra waiting room is for all patients that eventually the blood clinic will be moving there in a couple of weeks, I heard. However, you'll be able to go there and have your blood work. You'll be able to go there and see your nurse. And it will really avoid this congestion. And as we all know, cancer is increasing in our population. So I just want to share that wonderful experience. Thank you.
Thank you, Susan. And you're absolutely right. Our cancer program has grown enormously. And it's grown with our community, and you're spot on. We will see a doubling in cancer cases in the next 15 years within our region. The opening, I was there for the opening of that new space last week. And I can tell you we moved administrative offices out of that area because we knew that patients needed the space. So thank you for bringing that up.
Thank you, Dr. Martino. Our next question is from Barry, who is joining us live. Good evening, Barry. Go ahead with your question. Hello, Barry?
Yeah. My question is concerning the wait time at Etobicoke General. Earlier, someone said it was 3 to 4 hours, but my experience is 8 hours waiting in the emergency. So I'm wondering why that is, wait time is so long.
Thank you for your question, Barry. I'm going to pass it over to Tony to answer that for you.
Yeah, thank you, Gurjeet. Thank you, Barry, for the question. As Dr. Martino highlighted earlier, Osler's hospitals have some of the busiest emergency departments in the province. When you look at your experience and looking at waiting over 8 hours, I want to reassure you that we continue to work very closely with our community partners to help people choose the right care options, including our urgent care center and Peel Memorial Regional Virtual Urgent Care Services and family doctors. This helps reduce pressures on our emergency departments and supports faster access to care. How much time you spend in the emergency department can vary depending on the test, specialist consultations, and whether you need to be admitted to hospital. And so the time that you were at Etobicoke General and had to spend 8 hours, there may have been fairly acute patients requiring access to emergent care, could have been critically ill. And this is part and parcel to how we manage all of the patients that come in through the emergency department. They're triaged appropriately, and our teams work 24/7 to provide compassionate care. I will remind you as well that we, as Dr. Martino highlighted earlier, we do have wait time clocks available on Osler's website to provide up-to-date information on the estimated wait times. And we also have patient concierge to support patients and families during their visit. Thanks again, Barry, for the question.
Thanks, Tony. Our next question is also live. We have Brenda joining us. Brenda, go ahead with your question.
Yes, hi. I am just wondering what your plans are for this upcoming viral season in terms of frontline staff masking for patients or requiring patients to mask in care areas.
Thank you for your question, Brenda. I'm going to pass it to Dr. Martino to answer.
Brenda, you pose a very important question. Our staff has the opportunity to make a decision when they see a patient of whether there is a risk that they need to mitigate by masking, and the type of mask they need, and the personal protective equipment they will need to take care of that patient. If we have patients that clearly have a respiratory infection, we will put masks on those patients. Much of our staff does during respiratory season wear masks voluntarily. Many know that they have this opportunity to use whatever personal protective equipment is necessary to reduce or eliminate risk to themselves and to patients they're caring for.
Thank you, Dr. Martino. Our next question is online, and it's from Christian. Christian says, I had ACL surgery at Etobicoke General Hospital a year ago, and everyone from the surgeon, the nurse, and all other staff were amazing. Thank you for the amazing work of the Osler team.
Thank you very much, Christian. It's Kiki Ferrari. I'm the Executive Vice President and Chief Clinical Officer at Osler. I want to say that hearing about your positive experience is always very welcome. And I know that the team would really appreciate to hear these compliments. And I encourage everyone, when you do receive great care, to reach out. It means very much to us when you acknowledge our care and acknowledge the great team that we have. So I hope you're feeling better, Christian, and hopefully you've recovered now since it's been a year. Thank you again.
Thank you, Kiki. We would now like to thank you, everyone, for your great questions. We will have time for more live questions in a few minutes. I would like to now announce the results of our first polling question. So our question was, before this evening, were you aware of Osler's plans to transform the Peel Memorial site into Brampton's new hospital? 36% of you said that yes, I'm very aware of Osler's plans to transform Peel Memorial. 40% said I am aware, but don't know the details. And 24% of you said, no, I was not aware of Osler's plans to transform Peel Memorial before this evening. Thank you for your feedback. This is very important information for Osler. I will now turn it over to Kiki Ferrari, Osler's Executive Vice President and Chief Clinical Officer.
Thank you, Gurjeet. Good evening, everyone. It's wonderful to be back at this event. This is now my 10th telephone town hall here at the wonderful Osler. I'm sure you know the fall season is a time when Osler and other hospitals across Ontario see higher volumes of patients. You've heard a couple times our team talking about our emergency departments and urgent care center. They see more than 310,000 patients each year. Osler's staff, physicians, and volunteers are working hard to ensure the community continues to receive the care it needs and deserves. And we are here for you 24/7. And I want to thank the incredible Osler team who deserve high praise for the work that they do. Despite serving one of the most diverse and rapidly growing communities in Ontario and operating one of the busiest emergency departments, Frank talked about our ranking amongst peer national hospitals. To clarify, Osler ranks third out of 57 peer national hospitals for the shortest wait time to an initial physician assessment. This remarkable achievement is a clear testament to our team's ongoing commitment to delivering world-class care. And remember, your care begins the moment you are triaged, well before you see a doctor. How much time you'll spend in the emergency department can vary depending on what tests you may need. Tony talked about that, whether a specialist needs to be consulted, or whether you need to be monitored, and whether you need to be admitted to a hospital. As we head into the holiday season and the snowy, slippery months ahead, we've already seen a little bit of that already, please remember that the emergency department is the right place to go if you are seriously ill or if your baby is under 6 months old. For all other urgent but non-life-threatening concerns, there are many care options available to you and your family, including Osler's Urgent Care Center at Peel Memorial that we've talked about, regional virtual urgent care services, and as I've stated previously, calling 811 or going to the website health811.ontario.ca or connecting with your family doctor. If you have a life-threatening emergency or aren't sure, as I told the previous caller, call 911 for an ambulance. On behalf of Osler, we thank patients and families for their patience and understanding as our teams work hard to provide care to all. Before I turn it back to Gurjeet, I want to acknowledge Osler's Mental Health and Addictions program. Last month, this important program was highlighted in a compelling CTV News Toronto segment with renowned CTV reporter Pauline Chan. This segment shined a light on all of the exceptional care provided by Osler's Addiction Services program. The remarkable work of the team to virtually eliminate wait lists and make sure patients get the care they need. Well done, team. I'm also very proud of our diagnostics imaging team, which was also recently highlighted for making MRI-guided breast biopsies available at Brampton Civic Hospital. This is a highly specialized test that improves the quality of care we provide to our patients close to home. And last but not least, I want to mention our teams in the simulation program at Osler. Osler has simulation labs at both Etobicoke General and Brampton Civic to expertly help our clinicians and learners train, and we've been evolving and expanding these labs to increase capacity and evolve their capabilities. Just a few weeks ago, we had the honor to proudly showcase the simulation lab at Etobicoke General Hospital to the Honorable Marjorie Michel, Canada's Federal Minister of Health, who was impressed with Osler's dedication to innovative learning experiences that are people-centered, collaborative, high quality, and that foster a culture of continuous improvement. I'm so incredibly proud of all of our teams across our 5 sites. Thank you for your time today, and back to you, Gurjeet.
Thank you, Kiki. Before we take more phone and web questions, I would like to ask Tatiana Rivera, Executive Vice President, Quality Research and Chief Nursing Executive, to join us.
Thank you, Gurjeet, and good evening, everyone. It's a pleasure to be part of this event once again and share some exciting news about the Osler Research Institute for Health Innovation, or ORI-HI. ORI-HI is informed by the needs of our communities and driven by Osler's research expertise. It brings healthcare, technology, and academic partners together to create real-world solutions that generate meaningful local and global impact in health outcomes. We also want to be sure that our communities are involved, and a key part of these efforts is Celebrate Research Week, Osler's signature annual event, which brings together researchers, academic institutions, health organizations, and innovation hubs to showcase how research improves lives, strengthens communities, and shapes a better future for healthcare. This week is not just for researchers. From November 17th to November 21st, you, our community, are invited to attend research open houses at Osler's sites, hear from leading experts at ORI-HI's inaugural research symposium, and attend talks by Osler's Quality Improvement Academy. The detailed schedule and information on how to register for the event are available at williamoslerhs.ca/CRW. All events are free to the public, but advanced registration is required. I encourage you to attend, to learn from, and to engage in meaningful conversations with local researchers, clinicians, community partners, and students about how research contributes to improving health policy, health outcomes, and everyday well-being. I am also very proud that together with national partners, ORI-HI has launched a national advocacy campaign to encourage researchers and research partners to embrace Celebrate Research Week, not just here, but across Canada. While this is still in early stages, we are very pleased with our partnerships with Research Canada and Community-Based Research Canada that are amplifying the message that research is part of improving the health of our communities. If you're interested in the exciting work happening through the Institute, I encourage you to follow us on LinkedIn for the latest news and upcoming events. Thank you, and I pass it back to Gurjeet.
Thank you, Tatiana. We would now like to open the line to answer more of your questions. Please press *3 on your phone to bring you into the question queue and speak with Osler's leaders. Again, we kindly ask that you keep your question brief so that we can get to as many as possible. Our next question is from Rajesh, and it's an online question. Rajesh is asking, how is Osler going to integrate the new TMU School of Medicine students into its current operations? I'll pass that question on to Dr. Shaw.
Thank you, Rajesh, for your question. Osler has a long-standing commitment to medical education and to provide an important learning environment for medical learners in one of what we consider to be Ontario's leading health systems. In fact, TMU medical students and residents are already integrated into our hospitals. They work alongside our skilled clinical teams, providing equitable, high-quality care directly to patients and they're gaining hands-on experience. We hope that by learning and caring in Brampton and Etobicoke, many of these students will choose to build their careers and lives here. And we're, for that reason, excited about this partnership, as it will ultimately strengthen community health and wellness, the health workforce. It will support research, innovation, boost our local economy, and most importantly, improve the health of our community.
Thank you, Dr. Shaw. Our next question is also an online question. We have this question from George. And George is asking, during COVID, there was a telehome program. Can this continue during respiratory season to help clear beds and patients be taken care of in the community? I'll ask Tony to answer this question, please.
Yeah, thank you, Gurjeet, and thank you, George, for the question. A really important question and really a primary strategy in how we support our ongoing pressures during cold and flu season. So you'll note that there's been some significant learnings from COVID, and we have a number of programs that help support patients. One of the programs that you highlighted, we actually pulled some learnings from that program and help support patients in their home when they need oxygen. We also have a very strong partnership with Bayshore Health. We have what they call Osler at Home, which is a 16-week program that helps support patients coming out of hospital in terms of getting back to independent care. We also have a very rigorous 8-week program that helps support patients in avoiding an admission. So in lieu of being admitted, we put supports in the home so that you can stay home and be cared for at home. And we know from a home first perspective, that's where you want to be, and that's the best place for you to be. We also have a very strong partnership with community paramedicine, where we have paramedics come into your home and do a check and help support you as a part, an effort to avoid an admission or to support you after an admission while in hospital. So thanks again, George, for the question.
Thanks, Tony. Our next question is a live question. We have Tony joining us live on the line. Tony, go ahead with your question.
Hi, the question is two-part. One is that one of my friends was in the hospital for an emergency. He had a very acute pain because of the stones. Now, during that emergency, he saw that the doctor and the nurse, they were talking amongst themselves and discussing about their phone plans, what type of a phone plan they have. And this is how these people are wasting so much of time, and people are waiting in pain and agony. So that's one part. The other part is that we have shortages of doctors, and we have so many doctors who have been as a doctor in Middle East and other countries working for 10, 15 years. And when they come here, they are driving taxis or they are doing some very menial type of a job. This is a sheer waste of our talent which we have, and we are not using the talent. I'll appreciate your answer. Thank you.
Thank you, Tony. I'll pass the question on to Dr. Shaw. Dr. Shaw?
Yeah, thank you, Tony, for your question. First of all, thanks for recognizing that healthcare workers are humans too, and we are not perfect, so we appreciate that feedback. I would say that I've worked in a few places now. Osler is without a doubt an organization that's leading the advocacy around ensuring that physicians, other healthcare workers who are trained in other parts of the world are being given the opportunity to practice in Ontario. Our medical learner cohort right now is completely enriched with international medical graduates, and we are working very diligently to create pathways for them to get trained and credentialed and begin working in Ontario and Canada, because we believe exactly what you were saying, that there aren't enough healthcare workers, and we want to be part of the solution. So thank you very much for your question.
Thank you, Dr. Shaw. Thank you, everyone, for your insightful questions tonight. Just a reminder that if we were unable to get to you tonight, we are gathering your information so that we can get back to you and answer the questions you have as best we can. I would now like to invite Tony Razzo, Vice President, Clinical Services, on behalf of Mary Jane McNally, who is not able to join us this evening. Tony?
Thank you, Gurjeet. It's great to connect with so many in our community. Osler is a health system caring for one of the most diverse regions in our province. I'm pleased to share that Osler is home to the Black Health Social Services Hub Connection Point at Peel Memorial. This is an important resource for members of the Black, African, and Caribbean communities who need to connect with a physician or a nurse practitioner or access education, community resource support, and counseling in key health areas such as the management of diabetes, breast cancer, and mental health and addictions. This much-needed partnership aligns with Osler's values of collaboration and respect, demonstrating Osler's ability to impact population health outcomes and enhance access to care for equity-deserving communities. As a part of Osler's work to bring patients, families, and the community together with hospital staff and leaders, Osler recently held its second annual Patient Experience Symposium. The event was a great chance to connect with our community, including patient family partners and patient experience leadership within and outside of our region. We listened, learned, and shared ideas about the power of kindness, the importance of patient and family voices in change, the interface between technology, artificial intelligence, and patient experience, and how we all need to be fearless in our care connections. Before I pass it back to Gurjeet, I wanted to mention our ongoing efforts to provide culturally safe care. Osler is proud to offer ongoing education sessions, allowing staff, physicians, and learners the time for self-reflection, dialogue, and information about humility, protection of cultural and religious requirements, trauma-informed care, and the importance of shared decision-making and partnership with all patients. These learning moments are conducted in collaboration with community partners and include interactive discussions and case examples to build confidence in addressing cultural, spiritual, and identity-based needs in care delivery. For Osler, being truly people-centered means creating a care experience where patients and their families feel heard, understood, and respected. Thank you, everyone, and Gurjeet, back to you.
Thank you, Tony. We now have one final polling question to ask you tonight, and we would appreciate your feedback as it will help us to plan future Osler events. To answer this question, please press the number on your phone that corresponds with your answer. Our third and final polling question is, did you find tonight's telephone town hall informative? Press 1 if your answer is yes, this has been informative and I plan to participate again. Press 2 if your answer is somewhat, I found tonight's event fairly helpful. Press 3 if your answer is no, I didn't feel it was informative. I will now turn it over to Dr. Martino for some final thoughts.
Thank you, Gurjeet, and thank you for so proficiently moderating this evening's telephone town hall once again, and for being such a valued member of Osler's Patient and Family Advisory Council. I also want to thank my colleagues for providing valuable updates and responding to our community's questions this evening. This evening, we've reached over 7,000 households over the past hour. We are grateful to have had the opportunity to connect with so many of you. We're honored to be your local hospital system, and your presence this evening is a wonderful reminder of the strong connection we share as a community dedicated to health and well-being. We will be hosting another Osler telephone town hall in the spring, and we hope you can join us once again. As always, we'll continue to keep you, your families, and our community informed about hospital updates through our communication channels. On behalf of our staff, physicians, our learners, and volunteers, please accept our sincere gratitude for your continued support of our healthcare teams. Thank you, and have a great rest of the evening.
This concludes Osler's telephone town hall. Thank you to all our speakers for sharing their updates this evening, and to all of you for your thoughtful questions and active participation. The recording of tonight's call will be available on Osler's website in the next few days. If you have questions that we did not get to, please email them to publicrelations@oslerhs.ca, and we will respond to you in the next coming days. Once again, that's public relations, one word, at williamoslerhs.ca. Thank you again, and enjoy the rest of your evening.